And part two of our healthcare finance topic, we'll talk about government-sponsored health coverage. The first one that we are going to discuss will be Medicare. So what is Medicare? Medicare is a part of the original Social Security Act of 1935. It was added as Title 18 in 1965. And it is financed by payroll taxes. So you may notice in your pay stubs, part of the Medicare tax, payroll tax, you will actually see this. If you are working, you are contributing towards this. All Americans, including those that are permanent residents, are entitled to health insurance benefits if they are 65 and above, and if they have contributed to Medicare through payroll taxes. In 1965, around 20 million were entered into the system. A few expansions happened through the years. The first one was in 1972. It started covering younger people with certain permanent disabilities, and it also started adding people with end-stage renal diseases. So chronic kidney disease that would require end-stage interventions such as dialysis, hemodialysis. Further, in 2001, people with Lou Gehrig's disease, also known as ALS or amyotrophic lateral sclerosis, were included and as being part of those persons with permanent disabilities. So it's about 14% of the federal budget. And in 2018, the Medicare program cost about $582 billion. Who's eligible again? So 65 years old and above, if you or your spouse are eligible for Social Security pension and that you've paid payroll tax contribution for at least 10 years. So you need at least 10 or more years working in the United States and doing contribution or giving contribution towards your payroll taxes. You should be at least United States citizen, or at least a legal permanent resident, also known as green card holders. If you are 65 and above and you did not make enough payroll contribution, meaning you did not meet the minimum of 10 years, you can still enroll with monthly premium, but however, your monthly premium is going to be higher than the standard because you have not met the minimum a number of years. So let's take a look at this demographics in terms of the number of people benefiting from Medicare. So as of 2016, this is the latest available data in terms of aggregate data, including the different parts. So there were about close to 57 million Americans and permanent residents that are under Medicare. So around 48 million out of this 57 million were 65 and above, and the rest are younger but with certain disabilities. As you can see, Medicare has 4 parts: Part A, Part B, Part C, and Part D. We're going to talk about this in more detailed manner later on. But Part A, which is one of the original components of Medicare, along with Part B, a vast majority have either Part A and Part B, and you will actually learn why this is so, because you can't really enroll in Part C and Part D if you are not first enrolled in Part A and Part B. Moving along. So let's talk about Part A first. Part A is specifically meant, for inpatient benefits, hospital benefits. Okay, so inpatient. There is an initial deductible. Please remember this terminology. You have learned this in the previous session. And there is a daily coinsurance. This, of course, is when you get hospitalized. You know what a deductible is. So once you've met this in the year, in your coverage year, your insurance kicks in. But there is also a daily coinsurance aside from the initial deductible, and these are the amounts for 2020. Okay, so the first 2 months, you really don't have a coinsurance, but this amount's actually increased the longer you stay in the hospital. And this is very important because if you notice, nursing home is covered. Nursing home inpatient stay is covered on the first 20 days. Then you start having a coinsurance up to 3 months, up to the 100th day. But after that, it won't cover nursing home inpatient stays anymore. This is why another government program, which is Medicaid, is the major payer of extended nursing home stays. We'll talk more about that when we go to Medicaid. Other services covered by Part A would be home health service benefits and hospice benefits. The next part is Part B. It has a deductible of $198 in 2020, $198. There is also a premium, so a monthly premium of $144. That's the standard one in 2020, but it could go up if your income is more than, it can go up to as much as $400 a month if your income is around this figure, $214 for individuals and $428 for joint filers, spouses. And what are the benefits in Part B? Well, you have the supplementary medical insurance program. We'll talk a little bit about that. This is voluntary. Physician services is covered. Outpatient visits are covered. Same thing with Part A, home health is covered, and preventive services as well. So most enrollees with traditional Medicare, notice they call Parts A and B as traditional Medicare because those were the two original parts when it was enacted in 1965. So most enrollees of Parts A and B would need supplemental coverage because it is not free. If you remember in the previous slides, we talked about deductibles, coinsurance, and cost-sharing requirements. So how are you going to be able to afford that? The best way to do that is to have a supplemental coverage to pay for those out-of-pocket costs. So some people have retirement health plans. You're lucky perhaps if you are part of a very of a union that has a comprehensive retirement health plan. Once you hit 65, that health plan will actually cover for your deductibles, your out-of-pocket costs for your Medicare. Medigap, you could purchase that actually, and the average premium is $180 per month. So that's worth it because for $183 a month, those out-of-pocket from Parts A and B will be covered. If you are dually eligible, meaning you are both eligible for Medicare and Medicaid, Medicaid will then kick in and pay for this out-of-pocket costs. So this is one of the best case scenarios for seniors is to qualify for both Medicare and Medicaid because Medicaid then covers for this out-of-pocket costs. Let's talk about Part C. So in 2017, there were about 19 million, or 33% of the total Medicare recipients have enrolled in Part C. So Part C is purely voluntary, and there are different premium costs for plans. This is also known as Medicare Advantage program, or what we call uh, managed care, Medicare. If you notice, around October or November, there would be a lot of posters and there's a lot of media blitz calling on Medicare recipients to sign up for Part C. And this media blitz campaign comes from health insurance companies because they're the ones selling these plans. So what happens if you have Part C? Well, you can only sign up for Part C if you have signed up for Part A and B. That's a must. And if you enroll in Part C, you then choose a private health plan that will be your managed care health plan that will take care of you. So just like the different managed care plans, HMO, PPO, POS, all those other things, commercial health insurance companies actually offer these, what they call their Medicare plans. There's also what we call special needs plan if you also qualify for Medicaid. Now, private plans, they're actually a huge moneymaker for this private healthcare companies because there is a higher reimbursement rate, and it's very popular in states that have huge population of retirees. This health plans provided benefits covered by Medicare plus more because private plans are supposed to come up with their own benefits. So rather than having Part A and Part B alone, wherein you pretty much navigate the healthcare system by yourself, usually if you have Part A or Part B, for the most part, you will be asked to pay for the services first, then you file a claim to Medicare. And then Medicare will then reimburse you. If you have Part C, you don't have that to worry. You don't have those things to worry about because you are now under a managed care. So these private health companies will be the ones to manage your care. A lot of them actually cover prescription coverage. This is one important thing if you are going to advise someone who is going to sign up for Part C. One of the things they should look at, specifically if they have a huge prescription requirement, meaning they have a lot of prescriptions, medications needed, they might want to look into a Part C health plan offered by these insurance companies, whether they also cover prescription. This requires an additional deductible, of course, which is another out-of-pocket for them, for a Medicare recipients who sign up for Part C. Now, private health plans who actually sell Medicare managed care plans are required to use the savings to either add benefits into the health plan that they're selling or lower their premiums. The last part, or the fourth part of Medicare, which was a more recent addition, is called Part D Medicare, which is an outpatient prescription drug benefit administered again by private health plans. Now, please take note of this: outpatient. These are your prescriptions that are prescribed to you, for instance, by your primary care provider. Now, we're saying outpatient because whatever prescription drugs you need while being hospitalized is covered by Part A, because that's part of hospitalization. If you get hospitalized and you need medications during your hospitalizations, then that will be included in that benefit. There are in 2018, about 782 standalone drug plans. So these prescription coverage plans are meant just for prescriptions. So it was authorized in 2003, launched in 2006. Just like Part C, Part D, you can only enroll in Part D if you have qualified for Part A and Part B, if you're enrolled for both. And as of January 2007, there were 24 million enrollees when it was launched, and it has increased to 42 million in 2017. Now, these premiums, the cost of premiums per plan is different across the United States, just like any other health coverage or prescription coverage. Now, enrollees that are low income can receive additional assistance with cost sharing, for instance, copayment by Medicaid. So if you're also eligible for Medicaid, Medicaid will pay for this out-of-pocket cost, because you are going to have an out-of-pocket cost when you sign up for this. All right, this is a very busy slide, but bear with me for a few minutes as I explain this to you, because this is very important. One of the biggest flaws of Part D Medicare is that when it was originally envisioned and the way the mechanisms put in place was that there was a coverage gap, or what we call the donut hole. So pretty much this is how it works. If your cost is below $1,000, or below this threshold, your deductible is $405. Once you reach this cost, you pay 25%, and your Part D prescription coverage pays for 75%. This is as of 2018. And the coverage, if your drug expenses go above this, you go up to the coverage gap. Now the coverage gap is really a big disadvantage for a lot of people, or was a big disadvantage for a lot of people, because it's like you're being punished for having more prescription needs. So look at this. You literally pay for almost everything. So you pay 35%, plan pays 15% for brand name drugs, and you have to apply for a manufacturer discount. Now, this is a huge chunk because you have to pay 35% versus 25%. For generic drugs, you pay almost half of it, but the plan pays 56%, whereas here the plan pays for 75%. Now, if you go above this, if your costs go above this threshold, then it's called the catastrophic coverage, wherein the plan pays 15%, Medicare itself pays for 80%, and you only pay 5%. Now, this whole thing, this coverage gap, was actually closed because of Obamacare. So as of 2019, look at this. Instead of paying 35% for brand name drugs and 44% for generic drugs, you now just end up paying 25%. I mean, it's almost the same as this, right? However, manufacturers were the pharmaceutical companies were the ones required by this revision or this update by Obamacare to cover most of these. So if you notice here, 50% of pharmaceutical companies are the ones covering it, right? But not for generic drugs. As of 2019, this donut hole, the coverage gap, was closed. So the enrollee now pays 25% in the coverage gap. The pharmaceutical companies pay for 75% of the cost, and the plan pays only 5%. Now, the same holds true in the previous arrangement for catastrophic coverage. Of course, drugs are the cost of drugs are ever increasing, so it's different for 2020. But nonetheless, what I want to emphasize here is that this coverage gap was closed. This is not really being talked much about, but this is one of the benefits of Obamacare because it got rid of the donut hole. Other changes made by the Affordable Care Act are the following. So Medicare beneficiaries are no longer required to have out-of-pocket costs for annual checkups, meaning their preventive care. preventive screening. We're talking about, cancer screenings, colonoscopy, those things. And as I have mentioned, the gap in the donut hole was closed. So basically, recipients are now just going to pay 25% of the coverage gap, as I've shown you in the previous slide. Now, if you are earning more, there will be higher premiums for you. So this is also one way. This is one of those things wherein a lot of the funding for the Affordable Care Act actually came from Medicare, revisions in the way Medicare works, especially in Part C. If you're single and make 85,000 and married, and your dual income is 100, your combined income is 170,000, your premiums are going to be higher. I've mentioned that previously. And of course, reduction in payments to insurance plans for Part C. This is very contentious because remember, Part C, which is very beneficial to Medicare recipients, this basically required insurance companies to meet certain criteria before they can be paid premium dollars by the government. So if you are an insurance company that sell a Medicare managed care plan, before you could get paid with top dollars, you have to meet certain standards. That wasn't the case before Obamacare. A lot of these plans pretty much didn't have to meet certain standards, and still they were making top dollar. So that was one of the things that Obamacare did as well to improve Medicare.